Welcome to Healthbeat, Bhekisisa's monthly television show. I'm Mia Malan. The world has come a long way with HIV prevention. Just over a decade ago, using condoms and getting your partner tested for HIV were just about the only ways to protect yourself from getting infected with HIV through sex. Now we have pills, vaginal rings and injections for protection against the virus. PrEP is a word you would have heard on this show. It's short for pre-exposure prophylaxis, which is medicine you take before being exposed to HIV. The PrEP ingredients that stop HIV from entering your cells are called antiretrovirals, the same type of medication that has transformed HIV from a death sentence to a manageable condition. Later in the show, we'll be talking to the health department about the affordability of a new jab to prevent infection. But first, let's hear from young people who have used the HIV prevention pill and the vaginal ring.
In Cape Town, the Desmond Tutu Health Foundation is taking preventative HIV medication to young people's doorsteps. These types of meds are called PrEP, which is short for pre-exposure prophylaxis. South Africa has about 500 new HIV infections each day, a third of them among teen girls and young women. Mbali Jonas is the Tutu Foundation's marketing manager. She ensures people know exactly where to find her team on any given day.
So the concept behind Fast PrEP is really just to try and create an HIV-free generation.
The Tutu teen truck is heading to Mitchell's Plain Town Centre outside Cape Town. It's one of 4 mobile trucks going out to different locations. They have 2 types of PrEP, a daily pill and a monthly vaginal ring. Ntombuvuyo Matola, the project manager, says they have reached over 10,000 youth in this area.
Some people are not always prefer going to the clinics because of long queues. They end up not getting help the same day. So we want to bring services closer to where they are needed.
Staffed entirely by young people, it's a one-stop service for both men and women under the age of 29.
Being fast refers to the fact that we don't want the youth to wait for services. We're trying to bridge that gap between waiting times so that they can access their sexual and reproductive health services.
The Tutu teen trucks are in different locations every day and return to the same spot within the month, so refills and follow-ups can be done on time.
They're able to come and speak to kind of people that are more like their peers and a space that is very much confidential.
The pill that trucks hand out can lower the chances of contracting HIV through sex to almost 0. But for that to happen, it has to be taken every day. The vaginal ring doesn't work as well as the pill. It reduces a user's risks of getting the virus by about 30%. But it only needs to be replaced monthly. Student Likona Matatu has been taking oral PrEP for the last year.
I had a boyfriend at that particular time and we're kind of icky. I was going in for contraceptives and then it was explained to me what it was and then I decided instantly there that I'm gonna take it.
On a good day, the team sees about 24 people.
So we are offering HIV testing and counseling. We also do STI tests. We also treat the STIs. If we find that they do have any kind of STI, we test them at point of care. And then we also initiate PrEP, be it oral or the ring.
Lily Twalolana has tried both the pill and the ring.
So I chose the TP ring because it's much easier to use than the oral PrEP. I don't like pills. Sometimes I forgot them. So the ring, I only insert it once and it lasts for long.
The ring is made of silicone and contains a drug called dapivirine. It works for 28 days, even during menstruation.
It's so comfortable and it's not difficult to insert it. Just like right now, I don't feel anything.
Single mom Esetutebe chose the pill.
I'm not dating at the moment, but I'm taking PrEP like every day. I don't have a problem with that.
but in future, I don't know what will happen. We're going out like weekends, something can happen. I know that I'm safe.
It's one thing to have HIV prevention medication available for use, but to get people to use it is an entirely different story. Joining me online to discuss this is Professor Linda Gail Becker of the Desmond Tutu Health Foundation at the University of Cape Town. She's also an infectious diseases specialist. Linda Gail, thanks very much for making the time to join us today. When we started to use PrEP, the oral pill, in South Africa in 2016, the uptake was pretty slow. Why was that?
Hi, Mia. Always happy to chat to you. Indeed. When we started in 2016, if you recall, the strategy was to try and make it available to what was considered the riskiest populations in the country. And that sort of went down the lines of key populations, namely men who have sex with men, sex workers, those populations. And I think that had two important implications. The one was it stigmatized the prevention methodology. The second was it caused the sort of othering attitude of, well, this is for other people, not for me.
Now, since then, more options have become available for HIV prevention, and we now have 3 types of medication we can use. Can you just break them down for us?
So the first, as you say, the first iteration was an oral pill. It's a 2 antiretrovirals in 1 tablet. You swallow 1 pill a day is the concept. And you take it as a person not living with HIV as protection against HIV. The second one that came through randomized controlled trial, the vaginal ring. So the ring is made out of silicone. It is infused with an antiviral called dapivirine. You insert it into the vagina. It can be self-inserted or inserted by a healthcare provider. And it sits very comfortably at the top of the fornix, right under the cervix. And over the next 28 to 30 days, it slowly diffuses the antiviral. So it's a brilliant concept. You have the antiviral right there where the business happened. And then the third agent is much newer. This agent is in an injection. It's an intramuscular injection, which has to go into the butt. It's quite a lot of volume, so it's got to be given by a trained professional. And that, brilliantly, only has to be done every 2 months. So every 8 weeks, you need to come in and get your next shot.
Now, the health department at the moment only distributes the pill, and I know that the vaginal ring is in implementation trials at the moment. But if you look at efficacy, then the pill seems to be more effective than the ring. So an average person would ask, why would anyone then choose the ring?
You're quite right, Mia. Oral PrEP is for all populations, highly effective in all populations if taken as prescribed. What's the difference between the ring and the pill is that I think, the ring is topical. It is in the vagina. Very little of it gets absorbed systemically. So there are very few side effects that are systemic. And I think it's going to come down to choice. Do I want to swallow something daily, or do I prefer to use something that is on the outside, if you like, but on the inside in terms of the vagina, but you don't have to actually take it into your system?
If we look at the injection, then trials have shown that it works better than the pill, and we will be receiving some of those injections in South Africa for implementation trials early next year, and you're running one of them. How are we going to know if people will actually use it?
That's exactly what these implementation studies are designed to do. The fact that the clinical trials are one thing, they tell us whether the product actually works or not. Thereafter, you've got to kind of do the real world experience. When you put it into clinics within our health system with all of its ups and downs and in-betweens, first of all, will people come? How many of them will prefer which one? And will they actually use it as prescribed? The implementation science or the pilots really lets us do the real world thing, but in a carefully monitored situation.
Now, one big problem with this injection is its price. It is really, really expensive. I know that it sells around 70,000 rands for one injection in the United States, but VIV has just announced recently that it will sell it at a non-profit price between 540 and 570 rands for countries like South Africa. But that is still too expensive for our health department because it's far more than what the pill costs. So what now?
First of all, we have to say, and I hear that affordability is really important, but we also have to say it's very expensive for young women and girls and young men to become infected with HIV, to learn their positive status, because then we do need to provide them with antiretrovirals, and that's lifelong antiretrovirals. Plus, it's all the cost of living with the virus. So I do think it's not just how much does it cost, but how well does it work, right? How much is the price or the value of saving someone from an infection and therefore giving them a better handle on a healthy and lifelong future. Having said that, we know that the price of these commodities come down as we take things to scale, as we use them. But I do believe there is a period before we get to that point where we've got to get the product into the country and use it. And that may need donor funding. It may need our friends at PEPFAR or our friends at the Global Fund to help us to be able to get those numbers up, get people to use these products, to understand what the value add is to our country. I believe it will be a lot. I believe it will make a difference to our epidemic.
Thanks, Linda Gail Becker, for your time and for your insights. After the break, we speak to Khadija Jamaluddin from the National Health Department to find out how much the department is prepared to pay for the HIV prevention injection. Welcome back to Healthbeat, where we're discussing HIV prevention medication. As you heard earlier in the program, there are 3 types of HIV prevention medication: a pill, a vaginal ring, and an injection. So far, the health department has only bought the pill. Joining me online now is the Chief Director for Procurement in the National Health Department, Khadija Jamaluddin. Khadija, thanks very much for making the time to join us today. How much does the Health Department pay for the HIV prevention pill?
Thank you, Mia, for having me. So one pack of the HIV prevention pill called TE, tenofovir intracetabine combination, is on average 64 and 81. So for a 2-month duration of treatment, it works out to about 129 rand for 2 months.
Khadija, studies show that the new HIV prevention injection, which you take once every 2 months, that's called CAP-LA, works even better than the HIV prevention pill. VIV Healthcare, the company which makes the injection, has now said that its non-profit price for countries like South Africa is around 570 rands. Can the health department afford to pay that?
That price is unaffordable for us at the moment. Obviously, the price that VIV has shared does not include the logistics price, and we are waiting for a revised price from them. Once that revised price is received, it will go back into the budget impact analysis which we've developed, which will inform whether or not that price is indeed affordable. But just on the face of it, given that it's 3 times what we would consider acceptable as part of the standard of care, it doesn't seem to be, but we would like to do the numbers properly.
So what happens if VIV does not go down with the price? We know that cheaper generic versions will be available, but that's going to happen at best in 3 years from now. So what happens in the meantime if the price is too high? Do we just not get it?
In the meantime, because of its affordability issues, it's unlikely to be available for widespread implementation.
Will the health department accept donations from donors, like for instance PEPFAR?
Well, we have to look at long-term sustainability of the program. Certainly, that's not something that we would refuse. However, it should be part of the implementation study that is taking place so that we can properly get the data that we need to inform future implementation.
What's happening with the vaginal ring? Will the department buy that? I know there are implementation studies running at the moment.
So currently, the recommendation from the National Essential Medicines List Committee, which is a committee that's appointed by the Minister to look at the evidence, did not support the use of the piperine ring at present. So because there is that concern about whether or not it is as effective as what we are currently using or better than, the recommendation is that we not use it for the time being until the results of future studies are available.
Khadija, thanks so much for your time today. That was Khadija Jamaluddin from the National Health Department. After the break, we look at why men with HIV get diagnosed later than women and what can be done about it. You're watching Healthbeat. We're focusing on HIV. I'm Mia Malan. In South Africa, gone are the days of fighting for access to ARV treatment. Now, the challenge is getting people to stick to it because it has to be taken lifelong. Among the reasons given by Treasury for the recent HIV budget cut of 1 billion rands is that the number of people who take their ARVs reliably has fallen. But a much smaller proportion of men with HIV than women are on treatment. According to researchers, almost 68% of men with HIV are on ARVs, compared to about 80% of women. And many men stop their treatment within the first 6 months. As a result, more men than women die of HIV in South Africa, even though there are many more infected women. With me to discuss why men often get diagnosed with HIV later than women and why it's often a struggle to keep them on treatment is Silva Shabalala from the Mpilu Project. But first, let's find out how ARVs, the consistent use of ARVs, can be used to stop the spread of HIV through sex. Mahali Malloy spoke to an HIV nurse at the Aurum Institute.
Mapeseka Mabena teaches people with HIV how staying on medication can help them live normal lives and also stop them from infecting their partners. The concept is called U equals U.
So the U equals U messaging is aimed at improving and also dismantling the stigma around HIV and also to ensure that people understand the benefits of taking their ART. So I'm going to use these 3 bottles in front of me to explain. So the first bottle represents, has got the navy blue beads that represent the HIV virus. As you can see here, it's blue all over and we only have 1 bead that is white. So the white beads, they represent the CD4 cells.
CD4 cells are soldiers in the blood that fight against infection. HIV attacks and kills these cells.
When one is living with HIV and not on treatment, this is how your body initially looks like. There's high levels of viral load and low levels of the CD4 cells. So for us to prevent this from happening, we put you on treatment so that your body can start to be stronger, because few weeks later, you start seeing now the virus gradually decreasing. As you can see now, the number of navy blue beads, which represent the virus, they start to decrease, and now we start to see the CD4 cells. After 3 months, you will be virally suppressed by taking your ART as prescribed by the nurse clinician or the doctor. So this is the end goal. As you can see, now we only have the white bits which represent the CD4 cells, meaning you are virally suppressed, meaning also again the virus is no longer transmittable. That is why we have U equals to U, undetectable equals to untransmittable.
Studies show that when there are less than 200 copies of HIV in a milliliter of blood, most lab tests can't pick it up. It also means there's too little virus in your blood to pass HIV on to others through sex. But you have to take ARVs every day to keep the virus at bay.
Silva, welcome to the show. Thanks for your time today. You train men to be coaches to others and peer mentors to use their treatment correctly. But you have a personal story about why you became interested in this issue. Can you share that with us?
At first, I lost 4 of my uncles from, HIV-related illnesses. And then when one of my brothers got ill, I then decided that I needed to do something. So I took a decision to say, you know what, I'm going to be there for my brother. I'm going to try and find out more about HIV. And I did exactly that. I encouraged my brother to start his treatment, and he started his treatment. Within a few months, he was back on his feet.
Silva, so you work with people like your brother who you helped every day. What are the reasons why do men stop taking their treatment or don't get onto treatment in the first place?
It starts with fear. Men are afraid. When men associate HIV with fear of dying, losing strength, losing power, not being able to work.
So this fear, how do you address it? You have coaches that you train at your project. How do they help men stay on treatment?
So what we did was, with the pilot that we did, we looked for men that are living with HIV, who are open about it, who are living so well, and we trained them.
Silva, can you give me an example of how would a mentor help someone to stay on treatment?
For an example, if a man shows up at a clinic, he gets tested, he tests for positive. He's referred to a coach who is based in that clinic. So that coach will take over from the nurses. He will take him through his own journey, where he will explain how he managed to overcome some of the challenges, what challenges he faces ahead. So he explains exactly how treatment works. And then from there, they exchange, telephone numbers where they can talk on WhatsApp, where they can maybe meet, depending on how, the man is struggling. So it means, he can see him on a daily basis until he's at a place where he can stand on his own. The coach will always be with him.
Silva, do you have data that shows how the coaching that you do has influenced adherence at the projects where you work?
When we started the project, the men that came into contact with the coach was at 28% when we started. Then at the end of the 7 months that we did the pilot, it was sitting at 96%.
Silva Shabalala, thanks very much for your time today.
Thank you very much for having me.
So we need more men tested for HIV so that they can get onto treatment faster and fewer men die of the disease. That's our last show for 2023. We wish you a happy and healthy holiday.